Did you know that your teeth and your mouth in general are a great indicator of your overall health? Well, that is the case, and I'm at Sunrise Dental in Raleigh talking with Dr. Dirk Weiss about some of the things that he can see when he's checking out a patient's mouth. So the mouth, the eyes to the rest of our body, huh?
Yeah, absolutely. What we really can see is that when the gums are unhealthy and the mouth is unhealthy, that's a better indicator of what's going on overall in the body, especially when we have situations or issues like diabetes and heart disease. Diabetes, heart disease, and periodontal disease, or some people call gum disease, really play well together, or I guess I should say really play badly together.
Right.
They make each other even worse than they would be otherwise. And you know, heart disease being high blood pressure and other disease of the heart, and of course type 1 and type 2 diabetes, and then periodontal disease, it's a constant infection going on. And what we're looking for is swollen gums, bleeding gums, if you brush your teeth and your gums bleed a lot, but also it could be really prolonged or bad breath that doesn't go away when you brush your teeth. Those are things that we look for as well. The way you, the best way to deal with that is just to have regular cleaning and screening, just to make sure that these kind of issues don't pop up. But especially people with diabetes and heart disease very much need to make sure that they go to the dentist regularly.
You could potentially save somebody's life with a dental visit.
Well, we actually have. We caught squamous cell carcinoma, oral cancer, for one particular patient, and got her on the path to recovery, and that was 5 years ago, and she is still here and still our patient and very happy. And so we're very fortunate that we have that ability to save lives occasionally.
Because your teeth are not, or your gums are not supposed to bleed. If you floss and you see blood on your floss, what should you do? Should you call your dentist immediately? Or
well, a little bit of bleeding, especially if you haven't flossed for a couple, 2 to 3 weeks, is not a big deal. But we're talking about severely swollen, inflamed gums, lots of bleeding, things like that. But if you haven't been to the dentist for 2 to 3, 4, sometimes 10, 12 years, and your gums are always bleeding, it's time to go.
And regular checkups every
6 months is what we usually recommend. For some people, every 3 to 4, but for most, every 6.
If you do detect some of these problems like gum disease in a patient, does he or she need to make more frequent visits, or is twice a year still sufficient?
Sometimes we can cure the issue and bring them back to twice a year. Sometimes they need to stay on more frequent visits, 3 to 4 times a month, 3 to 4 times a year, pardon me. But the nice thing is we actually have it in our ability to cure this and to take as opposed to just having to manage diabetes and manage the high blood pressure. We can cure the periodontal disease in such a way that it's no longer affecting your health in a bad way. And so that's one of the nicest things we can do.
Are there some medicines that can make dental problems worse?
Yes, there are. Medicines that treat epilepsy can give you swollen gums. There's medicines that chemotherapy can give you swollen gums. There's all sorts of medicines, and your doctor should tell you about those potential symptoms as you're taking those medicines.
Wonderful information to think about, Dr. Weiss. Thank you so much.
Oh, it was my pleasure. Thank you.